Hello, VIPs, virtually important persons, ministers, UN representatives, and experts in the field of vision. It's great to have you here today. Vision for everyone, unlocking human potential, no debate about that. But what we're about to bring you today in this event is some new data, some new information, two very important launches as well, and connecting the dots between eye health and the Sustainable Development Goals. You'll hear about the economic health and the economic case of eye health. You'll hear about what we're going to do in the next 10 years to get that concept of eye health for everybody, for everyone around the world, for that equality of eye health care to everybody in the next 10 years, that decade of action, and then how to do that. So the next 90 minutes, this is going to be a pretty impressive collaboration with data. You will be part of the Lancet Global Health Commission on Global Health Eye Health report. That is going to happen. The International Agency for the Prevention of Blindness are bringing us here today. This is part of their production, so it is really nice to be here as part of their production, but they're also going to be launching their Vision Atlas. And I know you're thinking, what is that? What on earth is that? You will find out in just a moment. Patience, please, everybody. And more questions. Who are you? Who am I? I'm Femi Oke. I'm your guide for the next 90 minutes. Let me tell you a few things that we need to just check off our boxes before we get started. This webinar is being recorded and it's also live right now on Facebook. If you would like to talk about this conversation that we're having, you can take it further afield on social media, #UNFOV. There's a Q&A tool wherever you're watching. You'll see that Q&A little section there. Comments and questions about everything you're hearing, the data that you're hearing about, please put in your comments, your questions, and I'm going to do my best to bring them into our event today. UN ambassadors, hello. Thank you very much for joining today. Really, really good to have you. If you would like to comment, you have something to add to our event, we'd love to have you. We have a virtual floor, but here's what you need to do. You jump into the Q&A section. Don't leave it too late so that we can get to you. We would like your full name, your title, and the country as well, so that you too can be part of the discussion. If we don't have all of that information, it'll be hard to include you. I'm going to add two more things. Make sure you have a good microphone and a video and your camera ready, because that's the way that we're going to bring you into the conversation. If there are any technical difficulties, sometimes that happens, that's okay. There's a little blue button, which is tech support. You can click on that and then you'll get some technical support, or there's an email, and let me just give you the email details, iapbevents@myt.uk.com, or you can email us at events@iapb.org, events@iapb.org, and then you will get the technical support that's needed, because I don't want you to miss out on a minute of our conversation today. The co-hosts and the co-chairs of our event today are the UN Friends of Vision group. We start with the ambassador, the permanent representative for the mission of Antigua and Barbuda, Ambassador Wharton Webson. Over to you.
Can you hear me now?
We hear you beautifully.
Thank you.
Hello,
so much.
Ambassador.
Thank you so much, Phoebe. Thank you very much, and it's what a pleasure to be with you and to be in this event. Madam Chair, it's unfortunately the President of the General Assembly, while we will hear from him through his video speech, has asked that we make an apology for him, because he would really have loved to be with us in person. Madam Henrietta Foy, it's a great honor to have you with us. Thank you so much for joining us. the head of UNICEF. We are really pleased because we see children as a vital part of this campaign and the global attention and vision. Stuart Simon, Assistant Director General, WHO. Ms. Beat Andres, Special Representative to the UN and the Director International Labour Organization. Thank you both for being here. Fellow co-chairs, my dear friends from Ireland and Bangladesh, Geraldine and Robert, always a pleasure to be working with you. Excellencies, colleagues, and the many friends from the civil society who are here with us. We are really honored to have you with us. What a pleasure to have all of you join us at this unique event. The names are many to go through with our friends from the civil society, but please do know that we count on your support to help to push this agenda forward, and we thank you for your support. Colleagues, excellencies, we are here for this really exciting moment to release the Lancet Global Health Commission's magazine on eye health, and to release also the Iapb vision on their atlas on vision. And this is the kind of documentation that we need that will help, that has helped to build evidence-based, useful for all of us here and back in our capitals. 3 years ago, colleagues, there was virtually little talk at the United Nations headquarters of healthy vision and its contribution towards the many aspects of our society and the economic growth and the aspects dealing with the implementation of the SDGs, such as economic growth, decent work, education, gender equity, poverty alleviation, universal health, just to name a few. Whenever the conversation turned from the vision, it was always boxed within one context. It was always referenced to disability only. We, those of us who are persons with varying degrees of vision loss, are indeed disabled in some form. But we believe that access to good public health, access to rehabilitation, access to technology will help in creating the space and opportunity that will allow us, persons with vision loss, to participate and to help to to realize our objectives in meeting the SDGs. After consultation with colleagues, it was clear to me that the interest and support existed for the creating the Friends of Vision group, which we did. We thought that this group could be a place to share knowledge and experience on the issues and engage in governments at the UN and back in capitals on determining how to bring eye health into the efforts to advance the SDGs. The Friends of Vision have now benefited greatly from the leadership of my fellow co-chairs from Ireland and Bangladesh. And we formed the threesome with the other members of our group from throughout the United Nations family to make this group effective and to bring attention to one of the most significant needs of our time. The group realized its first goal and secured a specific language in the importance of health and vision, healthy vision, in the outcome document of the high-level event on universal health. In this high-level the resolution, we got for the first time references on eye health. We felt this was a major step forward. And while there is yet more to be done, a lot more to be done, we have gotten it in the UHC resolution and the attention is now drawn to, by ministers of health back in capitals of the need for their full inclusion and equity relating to eye health and to address persons who are facing this challenge. Today, our Friends of Vision group is thrilled to be to provide this platform for the Lancet Global Health Commission on the global eye health as they launch the magazine. This is a sneak view. Somebody told me they had not seen it before, so I thought, what a great opportunity to show it to everyone. The work of the commission provides the substantive basis for what many of us intuitively know is true, and that is that if people have access to healthy vision, we would make more equitable and faster progress towards the SDGs. We will also be able to use today's event to share with you the international agency, Iapb, new Vision Atlas. This atlas brings together all the available data and evidence on vision, something that we so badly needed, and putting it all in one place for ease to understand, with an ease and with an understand the format and secure the information we need. The momentum behind our work and the evidence base continues to grow. Many of my colleagues online here will now have seen that we have circulated a zero draft of a Friends of Vision and the first of its kind resolution to be tabled, we hope, for the UN General Assembly on healthy vision and the SDGs. We must embed the progress on vision in our work to advance the SDGs as we move towards providing equal opportunities and leaving no one behind. Colleagues, please take what you learned today from this discussion, share it with friends in capital, speak to others in your mission, speak to your leadership back home, because we believe that eye health is one of the key drivers in unlocking equal opportunity and creating equal equity in leaving no one behind. I thank you and I welcome your support and I welcome your engagement to this morning's discussion. Thank you so much, Phoebe.
Thank you very much, Ambassador Webson. Hello, Ambassador Fatima Rabath, Permanent Representative, Mission of Bangladesh. Great to have you. Also, co-host and also co-chair of the UN Friends of Vision Group. So many titles. Welcome.
Thank you very much, Femi. Thank you very much. And I'm also very excited to have you moderating us. I'm more used to seeing you on screen moderating much more important VIPs. Thank you very much. Excellencies, distinguished guests, members of the group of friends, a very good morning. And it is my pleasure to join Ambassador Webson and Ambassador Nessen in welcoming you to today's meeting. We are delighted to have such a rich panel today and also the presence of our friends and colleagues. It's very encouraging to see the growing awareness and support to this vital issue. And in this regard, I would like to pay a special tribute and thanks to my good friend, Ambassador Webson, for leading our work in such a sustained manner. Thank you, Ambassador. My apologies. I mean, you may see some background noise, and these are the perils of living in a condominium. No one seems to heed my desperate calls to shut their work for a few minutes, so apologies in advance. I wish to congratulate the co-chairs of the Global Lancet Commission on Eye Health, Vision Beyond 2020, Professor Matthew Burton and Professor Hannah Fall, the commissioners in the Secretariat for undertaking this very important work. And I also thank and congratulate Iapb for the publication of the Vision Atlas. Excellencies, I shall focus my remarks on the impact of vision health eye care on children. Vision plays an important role in children's physical, cognitive, and social development. I will speak today on the impacts of impaired vision on our children's education and more broadly in their lives. And I'm very pleased that the Executive Director of UNICEF, Ms. Henrietta Fore, is with us today, and she will further elaborate on the situation. Impairment of vision is one of the most common disabilities for children. Uncorrected vision can impair child development, interfere with learning, continue to affect health and well-being throughout their life cycle, and may even lead to permanent vision loss. Therefore, early detection and treatment are critical. Yet the vast majority of cases of vision impairment in children cannot be or is not corrected due to lack of access to eye health care. A staggering 91 million children have vision loss as they do not have access to eye care services. Unfortunately, the situation is far worse off for children in lower and middle income countries, as they have poorer access to eye care compared to high income countries. In high income countries too, services are less accessible to children of the marginalized sections and communities in the society. Distinguished friends, visual functioning is a strong predictor of academic performance in children. Children with visual impairment who lack access to vision correction are often at a disadvantage in terms of school enrollment, educational achievements, and learning. And this is especially the case, as I have said earlier, in low-income countries and also in sub-Saharan Africa, where children with vision impairment are up to 5 times less likely to be in formal education than children without disabilities. Globally, many children with disabilities never enroll in school or drop out prematurely. But even when children remain in school, visual impairment may contribute to lack of learning when vision correction services are lacking. Children with vision impairment often face social exclusion, and that can lead to lifetime impact on their livelihood and employment prospects. Excellencies, ensuring that children with vision disorders have the same opportunities as other children is a challenge in most societies. The UN Convention on the Rights of Persons with Disabilities calls for full integration of persons with disabilities in societies. Indeed, their exclusion from schooling constitutes a violation of their rights. The 2030 Agenda also places emphasis on realization of the SDGs by, for, and with persons with disabilities, including for people with vision loss. Improved education is crucial to reducing poverty, which is SDG 1, hunger, SDG 2, and enabling work, SDG 8. Therefore, achieving many SDG targets are not possible by leaving them behind, leaving those with vision loss behind. In terms of solution, comprehensive school eye health programs with strong collaboration between departments of health and education is crucial. The integration of primary health care into primary eye care into primary healthcare services for younger children could be crucial. I understand UNICEF is advocating for these and supporting many countries through such programs, and we'll hear more of these from Ms. Fore. Excellencies, distinguished guests, dear friends, the Friends of Vision have endeavored to raise awareness on vision issues in the UN, and we shall continue our efforts until we see tangible actions to eliminate avoidable blindness and low vision. The Lancet Commission report can play a catalytic role in this regard. We are at the final stage of tabling a resolution, as Ambassador Webson has said, on vision at the UN. We expect to start the informal negotiations on the draft next month, and we hope that we can adopt it very soon, perhaps even by this spring. We look forward to your support in that endeavor. In this 75th session of the United Nations, that should be a clear manifestation from this group and from the United Nations to leave no one behind. I thank you once again for joining us. Thank you, Femi. Over to you.
Thank you very much, Ambassador Rabab. Nice to have you with us. And so, this is a 3 co-hosted, co-chair hosted event. And we go now to Ambassador Geraldine Byrne Nason. She's a permanent representative of the Mission of Ireland. I can see that she has been working right up to the last minute, so her remarks are going to be fresh, exciting, and inspiring. Ambassador, over to you.
Thank you very much indeed, Femi. So no pressure whatsoever.
No pressure.
I'm delighted to come as the third of your troika of ambassadors, but I must say at the beginning, I want to say a really big thank you to my dear friend Aubrey, Ambassador Webson, for his literally quite inspired leadership on this issue here at the UN. As with Rabab as a co-chair of the group of Friends and Vision, I'm just thrilled that there's such a great turnout here today. I think that tremendous turnout again demonstrates what's really a powerful engagement and momentum that we now have behind us here at the UN. And I'll be really frank with you, it's not often we can say that about an issue at the UN. Sometimes the public perception of what we're doing here can be a little bit tired. But I can tell you the group of Friends and Vision, of which Ireland is very proud to count herself a member, really has that momentum behind us and our work. So I wanted to wholeheartedly welcome in that the landmark launch today of the Lancet Commission on Global Eye Health and the Iapb Prevention of Blindness Vision Atlas. You know, here in New York, contrary to what you might think about us, we don't just talk, we occasionally act. And you heard from both Aubrey and from Rabab that we're now with great energy working towards making it a reality, that the General Assembly takes notice of the important links between the role of eye health and sustainable development. And so we will move to what is actually quite a big deal here at the UN, to put a resolution on the table in the coming months. And you've heard from both of my colleagues previously just how we're preparing for that. I think today's event, and certainly the world's most respected journals lining up with hard fact-based evidence, really contributes to the work we're doing in preparing to get the support of 193 countries here at the United Nations behind this important recognition that eye health care can advance progress to the Sustainable Development Goals. You've heard just the litany of areas where this actually matters from both Aubrey and Rabab. So I think worth mentioning again, Rabab's particularly focused on education there, but also we need to repeat to ourselves, poverty, hunger, good health, well-being, decent work, all affected by the capacity we have to show how good eye health care is critical for our governments to pay attention to. But we also know, of course, that eye health is and can be a significant catalyst in promoting inequality. And that's something that we recognize, that inequality can be caused by and can be a product of poor health outcomes. I think it's staggering that we can say that today 90% of those suffering from unaddressed and debilitating vision across the globe are in low and middle income countries. Truth is, even in those groups, the heaviest burden falls on the elderly, on the vulnerable, on people with disabilities, and on those who live in rural and remote areas. One thing we know for sure is that the absence of basic eye health has a disproportionate impact on women and girls. We know that there are 8% more likely, women are 8% more likely than men to be blind due to unaddressed vision impairments. That's shocking. It also means that there are negative consequences, not just for the individual women and girls themselves, but for the communities they live in. And as we know, as women, often the communities they provide the heart for and lead. Eye health can have devastating consequences, as we've heard, for the fundamental issue, which is in girls' education, with those suffering from, and we repeat again and again and again to ourselves, preventable vision impairment, are quite literally often those left behind often meaning at the back of the classroom, unable to access and engage in what we insist is their right to education. Now, this has, of course, a knock-on effect on the participation of women and girls, and that's a tragedy in itself. It impacts on their engagement in the workforce. It promotes poverty amongst women and girls. It enables child marriage, and it impacts on the role of women in safeguarding the health and the education of their own children. But I want to push it one step further, because I fundamentally believe that unless women and girls are given the opportunity for their rightful education, and in this case, linked to that, their rightful health care, their capacity to participate in public life, in electoral processes, and taking it to its nth degree to lead politically, to build peace, to be involved in peace processes, is all affected by their being prevented from full participation in education. Now, as you can hear, I could actually go on, but I'll just summarize with the simple fact that, as you said at the top, Femi, good eye health care unlocks human potential. I want to close by thanking the Lancet and Iapb for your inspired and insightful work, which we will certainly use to help us help you move the dial on the global understanding of the impact of eye health on the lives of so many. And I just want to conclude in my own national language. Yesterday was the day of the mother tongue, by saying Guramila Mahagrev Galer. Thank you all very much indeed for listening and for providing such great momentum to this shared collective endeavour. Thank you, Femi.
Thank you, Ambassador Byrne Nason. So as we have discovered over the past 11 months, there are many ways to deliver a keynote speech. The President of the UN General Assembly, His Excellency Volkan Bozkır, joins us via video.
Chairs, Excellencies, ladies and gentlemen, thank you for the opportunity to address the Friends of Vision. I commend the group, and in particular the co-chairs, for continuing to elevate the importance of this issue, especially now in the context of the global pandemic. Like so many others living with a disability, the loss or impairment of eyesight has a direct impact on health, productivity, and well-being. As it stands, over 2 billion people globally have a vision impairment, and of these, at least 1.1 billion are living with vision loss because they do not have access to basic eye care services. This costs the global economy $411 billion annually in productivity losses. Excellencies, vision cuts across a plurality of the Sustainable Development Goals. Eye health is key to ensuring good health, mental health, and well-being. Poor eye health leads to an increased risk of mortality, of non-communicable diseases, and of mental disorders like depression and anxiety. Eye health has been shown to boost school enrollment and similarly strengthens gender empowerment, as 55% of people with vision loss are women and girls. And supporting those with vision impairment helps to reduce inequalities, as 90% of all those with untreated vision loss reside in low and middle-income countries. Those without access to eye care services include people living in rural areas, those with low incomes, women, older people, persons with disabilities, indigenous peoples, refugees and internally displaced persons, and migrants. Excellencies, the COVID-19 pandemic has exacerbated the inequalities in our world and highlighted the gaps that exist. Those living with disabilities are clearly amongst those being left behind. The disruption of healthcare systems, combined with a socio-economic system that has had to adapt rather quickly and abruptly to online and remote formats, has left those with vision impairment scrambling to adjust. We must extend our hands and our support now, in this time of need, more than ever. It is time for concrete actions, solutions, and partnerships to mobilize all necessary resources. We need stronger integration of eye care within national health services, including at primary healthcare level, to ensure that the eye care needs of more people are addressed through prevention, early detection, treatment, and rehabilitation. Ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. We will not regain progress on the SDGs or the Decade of Action if we fail to accommodate those with special needs. It is imperative that our efforts to recover from COVID-19 and to speed up support to the SDGs and universal health care in particular include support to vision impairment. Allow me to commend once again the UN Friends of Vision for taking the lead on eye health issue within the United Nations. Trust that you have my complete support in your efforts to include vision in the upcoming discussions around universal health care and in the draft resolution on eye health. Thank you very much.
Thank you very much indeed. His Excellency Volkan Bozkır, President of the UN General Assembly. That was keynote number 1. As I was getting ready for today's event, I thought, let me just look up the word keynote. And I know what it is, know what it does, but I wanted to be quite precise. Keynote presents the key issues to a group. The idea is to unify and arouse enthusiasm and interest. Aha! This is why we have the executive director of UNICEF with us. Perfect keynote speaker, perfect keynote speech. Be ready for it. Henrietta Fore, executive director of UNICEF. So nice to see you. Welcome.
Thank you, Femi. It is so nice to see you, and it is so much fun to see you. So I will add my voice to all these terrific keynotes, but it is a remarkable day that we are all gathered around today. So thank you, Excellencies, President of the UN General Assembly, permanent representatives of the missions of Antigua and Barbuda, Bangladesh and Ireland, my dear friends, Aubrey Rabab, and Geraldine. Thank you all for your strong words and your strong leadership in drawing attention to this important issue. Thank you also to the commissioners of the Lancet Global Health Commission on Global Eye Health and the scientists and researchers who are behind the International Agency for the Prevention of Blindness, Vision Atlas. Together, you built a compelling case for global action on vision, and that is what is important. Blindness and vision impairment affect a large number of children and young people. An estimated 1.4 million children are blind. Over 22 million have moderate to severe visual impairment, and over 46 million have mild vision impairment. As Aubrey said, we must start with children. The development impacts of these numbers are significant. Vision plays a key role in early childhood development, early learning, and education outcomes. It's also strongly linked to the capacity of children and young people to participate in society as they grow and develop. As Rabab said so well, it's also for social and economic reasons. As a matter of basic rights and justice, it is critical that we ensure that these children and young people have access to proven, evidence-based interventions and strategies throughout the course of their lives. This must include the critical periods, before and after birth, and throughout the earliest years. This includes vaccinations, vitamin A supplementation, safe deliveries and quality newborn care, as well as early screening, identification, and interventions for visual impairments. Over the years, UNICEF has built up a great deal of experience and expertise in promoting eye health as a priority globally, including through vaccinations and vitamin A supplementation. And around the world, we are strengthening our work around vision screening, early detection and early interventions, as well as assistive technologies for vision, including accessible textbooks, to help reach all the children with the education that they deserve. We're also focusing on supporting the skills development of older children as they prepare to enter the world of work. Assistive technologies, vocational training, accessible spaces, and rehabilitation services must be a part of our collective approach. Finally, as Geraldine said, eye health and girls and women deserve to be an integral part of health systems around the world as we continue working towards community-based primary health care as a means to reach truly universal access. Let's work together to ensure that interventions, screening, and solutions around vision are included everywhere, especially as we respond to the COVID-19 pandemic and begin the long task of recovery and rebuilding stronger health systems for the future. So UNICEF looks forward to working with all of our partners here today to make this a reality for every child and every young person dealing with vision issues, no matter where they live. So thank you all, and back over to you, Femi.
Thank you very much, Executive Director Henrietta Fore. Nice to have you with us today. So the International Agency for the Prevention of Blindness, you're going to hear their name one or two times in our session today, and that's because they are the producers of this session. What they do, they're an alliance of the eye care health sector across the world. So organizations, corporations, NGOs, civil society organizations, all coming underneath that umbrella. Peter Holland is the CEO of the International Agency of the Prevention of Blindness. He joins us for one of two official launches that we are doing today. Peter, welcome. How shall we start? Where are you going to start?
I mean, well, thank you very much. And as you said, for those who don't know us, Iapb, we're really the overarching alliance for the global eye care sector, and we're delighted to be co-hosting this event with the UN Friends of Vision and Lancet Global Health. And personally, I'm really honoured to be joining such a distinguished panel of speakers. The first Lancet Global Health Commission on Global Eye Health, which we're also launching today, it is a real landmark report. As we've already heard, and we're going to hear much more about, it sets out really new, compelling evidence on how critical eye health is to achieving the 2030 Agenda and the Sustainable Development Goals. And alongside that, it makes a really powerful economic case for investing in eye care. But we're also here to launch Iapb's Vision Atlas. The Atlas provides really the most authoritative source of data on global eye health. It draws on the most up-to-date data from the Lancet, the Vision Loss Expert Group, World Health Organization, and the Global Coalition on Aging International Vision Scorecard, supported by Roche. It allows you to access the latest evidence globally or in your region or in your country. And we're really grateful to our sponsors, Sightsavers, Bayer, Saver, the Fred Hollows Foundation, Allergan, and CBM, who've made this important resource possible. I'm particularly delighted that we're launching the commission at the Atlas with the UN Friends of Vision. Eye health wasn't actually mentioned specifically in the Sustainable Development Goals. But as we've heard already, and with particular thanks to the leadership of the three co-chairs of the Friends of Vision and the commitment of all its members, the importance of eye health as an integral part of the 2030 Agenda is now being recognised. You're going to hear lots of big numbers today, and we've already heard some of them. The Commission and the Atlas remind us of the enormous scale of the issue. 3 to 4 billion people worldwide need ongoing access to eye care. And as we've heard, 1.1 billion of them experience sight loss because they don't have access to the eye care services they need. And for the vast majority, that sight loss could be avoided. 90% of the sight loss that 1 billion people experience could be avoided, often with very simple interventions, such as a pair of glasses or a cataract operation. And as we've also heard, that lack of access is driven by and drives inequality, with sight loss far greater in lower middle income countries, among older people, and amongst women. Of course, behind those huge numbers are individuals, and individuals who aren't strangers. We all know someone with a sight or eye health issue. For me, if I take my glasses off, everything instantly becomes more difficult. I very quickly struggle to do my job. And I suspect for many of you, many of us watching, that's true as well. I'm sure you, like me, have experienced that panic of arriving at work or when you go out to the cinema and you find you've left your glasses at home. And of course, in the past year, we're all the more conscious of our eyes and our eye health, having spent so much time on calls like this and behind screens. And I think that makes it really very easy to imagine the impact of not having good access to eye care. And as a result of not being able to do your job properly because you can't see the screen or you can't thread a needle, of not being able to drive safely, or if you're a child, of not being able to see what your teacher has written on the black or white board, or indeed of not being able to see the faces of your family and friends clearly or at all. Because good quality eye care is vital to people's lives every day. And as the Commission and the Atlas show so clearly, it enables children to benefit from education, ensures working adults keep their jobs and to work productively, and enable older people to participate with their families and in their communities. So as we build back after the pandemic, I think all of us together have a shared responsibility to invest in and deliver the good quality eye care that's needed to ensure that no one's left behind. We'd now like to share a short video with you to introduce Iapb's Vision Atlas.
Welcome to the Vision Atlas, a panoramic view on all things eye health. Produced by the International Agency for the Prevention of Blindness, Iapb, the overarching alliance for the global eye health sector. At Iapb, we know that improving the world's eye health has far-reaching benefits for health, well-being, education, work, and ultimately the global economy. The Vision Atlas sets out a wealth of data in easy-to-understand formats that illustrate the inequalities of who is affected by vision loss and the inequity of access to eye care services across the world. The Vision Atlas is powered by the latest evidence from the Vision Loss Expert Group, the Lancet Global Commission on Eye Health, and relevant national bodies. It has been kindly supported by Allergan and Abbey V Company, Bayer, CBN, Saver Foundation, Sightsavers, and the Fred Hollows Foundation.
Today, 1.1 billion people are living with vision loss, limiting their education opportunities, income, and their increasing risk of early death by up to 2.6 times. The Vision Atlas highlights the inequality of vision loss across the world, showing that 90% of people with vision loss live in low and middle income countries, that 55% are women or girls, and 73% are over the age of 50. Vision loss costs the global economy $411 billion per year in productivity losses. But it doesn't need to be this way. For 9 out of 10 people with vision loss, the vision loss could have been prevented or could be treated now, meaning many people's lives could be so much easier if only they could reach the basic help they need. The Vision Atlas brings this data into the light so that the world can do something about it. Improving eye health is a practical, cost-effective way of unlocking human potential and achieving many of the United Nations Sustainable Development Goals.
The Vision Atlas enables the eye sector to speak with one voice to governments and policymakers.
The simple interactive tools on the Vision Atlas allow you to search and interrogate the database by age, gender, causes of vision loss, country and region over the last 30 years.
Understanding the causes of vision loss in your region enables us to work together on the appropriate eye care services to match the needs of the patients on the ground.
The Vision Atlas shows quite simply that the burden of vision loss falls on women and girls. This is an invaluable tool to advocate for access to eye care for everyone.
The Vision Atlas is accessible, easy to use, and provides simple, downloadable content, making it easy to present key data to the right audiences.
The data contained in the Vision Atlas is great for adding much needed evidence to media stories and to explain to a wider audience the importance and impact we should be making around the world.
We encourage you to explore the Vision Atlas online, where you can download relevant and specific resources for your needs.
Let's do a little show and tell of how the Vision Atlas actually works. And to do that, I'm going to bring along Jude Stern. Jude Stern has an unbelievable title. She's Head of Knowledge Management at the International Agency for the Prevention of Blindness. Jude, that is a heavy burden to bear, Head of Knowledge Management, but I know that you'll be able to do it really well. No pressure. Let's start with, how does the Vision Atlas tool, how does it show us where the areas are in the world where there's the greatest concern about vision loss? Show us that, Jude.
Thanks, Femi, and thanks for such a big introduction. And I just have to say at the beginning that to do the job of Head of Knowledge Management comes on the shoulders of many, many great people. And the Vision Atlas is powered by the Vision Loss Expert Group data, which is at such a level that we can actually refine and analyse the data and visualise it so that everyone can see it quite simply. So if we have a look on the prevalence map, we can see straight away the difference in the burden of vision loss across the world, with the countries that are in dark orange being around 18% prevalence of vision loss, such as Eastern Europe, and the countries that are in the darker blue colours, like North America, have a vision loss of around prevalence of around 5%. And these differences mainly come down to the ability to access good quality eye health services. Because, as many of the speakers have said, many of the causes are preventable or treatable.
Jude, will you show us one more thing, and that's a country level page. So if you could take us to, let's go to Bangladesh, because Ambassador Rabab will be delighted. She's one of our co-hosts and co-chairs for the Friends of Vision group at the UN. What are you going to show us now?
So I think the country pages are going to be a really valuable tool for advocacy and planning and research in eye care services. It pulls together data from a couple of different sources. So you can see an overview of the country, in this case Bangladesh, and we can see the enormous number of people that are suffering with vision loss or experiencing vision loss, and almost 1 million of those are blind. So to put it in context, we can see a little bit of data about Bangladesh, and we can also see the map where we can have a look at Bangladesh's neighbours and see the situation in that context as well. One of the powerful tools on the Vision Atlas is what we like to call the breakdown chart, where you're able to really look at the data in the way that's most appropriate that you need for your cause. This is available at region and country levels, and you need to read sort of some of the information around data limitations as to when to use which data set that's there. But you can have a look at the different age groups, you can have a look over time from 1990 to 2020, and you can also compare different locations. And just two extra features I'd just like to point out here is we have the national indicators that come from ministries of health or other relevant government bodies and give us an idea as to the level of services that are currently available or happening in the country through cataract information. We look at the number of personnel dedicated to eye care and any research, national eye health plans or resources that exist. And the one other thing that I really just like to point out on the page is that we also mention the Iapb members that work in that country. And we really want, the Iapb members, the broader eye care sector and the broader development sector to work together to be able to provide vision for all and unlock human potential.
Jude Stern, Head of Knowledge Management at IAPB, thank you for sharing your screen with us and doing a little show and tell for the IAPB Vision Atlas. Appreciate you. Now, you may remember a little bit earlier on, right at the beginning of our event, that Ambassador Webson held up to his camera a little sneak preview of the Lancet Global Health Commission on Global Eye Health. This is the official launch, so you're going to see a lot more and hear a lot more about it. I am going to hand over to Professor Hannah Fole. She is from the University of Calabar in Nigeria. Professor Fole, over to you. I love the suspense. Professor Fole, would
Thank you very much.
Unmute yourself. A little bit of drama being introduced into our proceedings. Professor Hannah
Can you
Fole,
hear me?
welcome. Yes, we do, and we see you.
Yeah.
Welcome.
Thank you so much. It's exciting to be in the same space with you, Femi. I've watched you often on Al Jazeera. But I think this is really quite emotional for me, having been grounded in the reality of working in mainly low and middle income countries. And so I would like to thank the Friends of Vision Group for taking us from health, eye health, now into development and into the highest global governance. I'd like to thank the co-chairs, the ladies, Rahab and Geraldine. And I'd like to thank Aubrey, who's been a co-traveler in this journey for many decades. So I'll just stop there and say thank you very much. And I hope eye health is now permanently ensconced in developments for all peoples of the world. Thank you.
Thank you very much, Professor Fole. We go now to Zoe Mullen. She's the Editor-in-Chief at Lancet Global Health. Zoe, nice to see you. Tell us more about this Global Eye Health Commission. What do we need to know?
Thank you very much, Femi. So my job here is to tell you a little bit about what a commission means, in the same way as you kind of delved into what a keynote was and how we've heard what an atlas is. So what is a Lancet commission? So my clicker's working, it is. So a Lancet commission, how we define a commission. It's a scientific review, inquiry and response to an urgent and perhaps neglected or understudied health predicament. So these commissions are science-led, and I can vouch for the amount of new research the commissioners actually did for this project. It's international, and here we have commissioners from 25 countries working on this project. It's multidisciplinary. We know that eye health is a cross-cutting issue and affects lots of different areas. So this is a very multidisciplinary commission. And they're focused on policy and particularly policy change. So you're going to be hearing about that from the speakers later on this afternoon in this section. Practically speaking, a commission is a report of around 20,000 words. So it's a big, meaty thing. You saw Ambassador Webson holding one up earlier, and I have yet to get my own hands on one of those. So they're a rarity at the moment. But they are also published open access online. So you can see this commission for free via the Lancet Global Health website. So we have this report, we have an executive summary. So if you don't want to read the whole 20,000 words, you can read the 1,000 word summary. And there's also an audio version of that to try and enhance accessibility a little. Commissions are usually commissioned by the editors. So we would propose a topic and we would choose the authors to go forward with that topic. Or they can actually be proposed by the researchers themselves. And in fact, that's what happened in this case. Professor Matthew Burton approached us with the idea for a commission on global eye health, and we worked with him to come up with a concept for how that might look, and then he took it forward. And that was around 2 years ago, so it's been quite a long journey for these researchers, and a very exhausting and tiring one. So I think this is the culmination of an awful lot of work. And so by the end of tomorrow, when we finished our launches, I'm sure they'll probably collapse into a heap, or at least have a very large glass of wine. So I, for one, heartily congratulate them on this inspiring and, I hope, influential, impactful work. And I really hope you enjoy the presentations to come. Thank you very much.
Thank you, Zoe. One of the reasons we're all here is to make that direct connection between eye healthcare and the importance of it around the world and the SDGs. Have a listen to this.
Healthy vision and eyes are something we take for granted. But nearly all of us will experience poor eye health during our lives. Today, 1.1 billion people around the world are living with vision impairment that has not been addressed. And there are hundreds of millions more who need ongoing eye care throughout their lives. 8 out of 10 people in need of eye care live in low and middle income countries. And many of those with vision loss cannot access the eye health services they need. Vision impairment has a huge economic impact. The estimated annual productivity loss is equivalent to $411 billion US. That's nearly twice the GDP of New Zealand. Poor eye health can impede learning, working, caring for others, reduce overall health and well-being, and can lead to lower life expectancy. These challenges have far-reaching effects on the world's development. And as more of us live longer, the problem is only going to get bigger. Fortunately, solutions exist. In fact, up to 90% of vision impairment could be prevented or treated with existing, highly cost-effective interventions. Yet services are under-resourced and least accessible to those that need them most. We need to work together to increase investment in eye care. Governments need to include eye care within their health systems, plans and policies, providing comprehensive services that put people and communities at the center of care through health promotion, prevention, treatment, and rehabilitation. And by reducing the impact of vision loss by creating inclusive and accessible environments. Collectively, we can help to deliver better eye health for all, while benefiting individuals and nations economically, and advancing sustainable development. Now is the time for action, to unlock the power of eye health for all.
You heard him mentioned a little bit earlier. Professor Matthew Burton is now joining us live. He's going to do a little bit of a deeper dive into the Lancet Global Health Commission on Global Eye Health. That is because he is the co-chair of the Lancet Global Health Commission on Global Eye Health. So he knows his stuff. It is really nice to have you, Professor Matthew Burton. Thanks for joining us.
Thank you, Femi. Excellencies, ladies and gentlemen, thank you very much for this opportunity to address you today at the launch of the Lancet Global Health Commission on Global Eye Health. This is a pivotal time for eye health. Last year was the culmination of the global initiative Vision 2020, the framework for 2 decades. In 2019, WHO published the World Report on Vision, and in 2020, the World Health Assembly passed a resolution on vision. Today, we would like to share with you some high-level findings from the Commission, which we hope will be useful in advancing understanding and catalysing action. The Commission explores eye health from several perspectives: the broad importance of eye health, the scale of the challenge, the economics of vision, the research needed, and finally, looking forward beyond 2020, delivering high-quality eye care for all. The Commission report is the work of an interdisciplinary group of 73 academics, national programme leaders, and practitioners from 25 countries. In addition to the main report, the Commission's subsidiary publications, case studies, and other resources can be accessed through the Commission website. The Commission examined the importance of eye health from several perspectives, including its impact on quality of life, general health, well-being, and mortality. Our starting point, however, was a detailed review of the relationship between improving eye health and advancing the Sustainable Development Goals. In a few moments, Brandon Artong will speak about the findings of this analysis in more detail. Briefly, we found evidence that the provision of eye healthcare services is associated with improvements in income and economic productivity, advancing poverty reduction, general health and well-being, educational outcomes, and reducing inequalities. There are multiple direct and indirect connections. Our overall conclusion is that improving eye health and reducing vision impairment is an important, if not an essential, enabler to advancing the SDGs. In a series of analyses, we mapped out the complex connections between eye health and general health. Impaired eye health has widespread direct impact, for example, through exacerbating depression and dementia, increasing cardiovascular disease risk through reduced physical activity, and increased risk of injuries. Impaired eye health can broadly compromise health and well-being. Vision impairment and eye health are often perceived to have little effect on mortality. The Commission conducted a systematic review and meta-analysis of the relationship between different levels of vision impairment and the subsequent risk of mortality. We found clear evidence of increased mortality risk with increasing severity of vision impairment. Worldwide, the scale of the challenge of vision impairment and eye health service needs is very substantial. New estimates have recently been published by the VLEG Global Burden of Disease Study for the year 2020 and are summarized in the Commission. Worldwide, there are 1.1 billion people living with vision impairment. Of these, 43 million are blind. 295 million have moderate or severe vision impairment. 258 million have mild vision impairment, which is below driving standard. And 510 million have unaddressed near vision impairment. There are large inter-regional differences in the prevalence of vision impairment. The highest rate, at around 11%, is in South Asia, and the lowest, of 3%, in North America. The regions with the largest absolute numbers of people affected are South Asia, East Asia, and Southeast Asia. And overall, 90% of people with vision impairment live in low and middle income countries. In all world regions, there are more women than men living with blindness or moderate or severe vision impairment. And by 2020, on the basis of current trends, it is modeled that 1.8 billion people will have vision impairment. These increases are partly driven by aging of the world's population. The Commission has analysed several aspects of the economics of eye health. In a few minutes, Patricia Marquez will say more about this work. We estimated the annual global economic productivity losses attributable to vision impairment using the latest data to be $411 billion. The Commission updated cost-effectiveness analyses for cataract surgery and refractive error services, which together account for 90% of unmet need. The good news is that both are highly cost-effective interventions. Advancing global eye health must rest on a foundation of solid evidence to guide policy and program decisions, as well as everyday clinical practice. The Commission did a global bibliometric analysis of the last 20 years of published research. This highlighted substantial underrepresentation of low and middle income countries and limited contextually relevant implementation and health systems research. We also convened the Grand Challenges in Global Eye Health project, a multi-round Delphi exercise which involved more than 300 experts from 118 countries contributing ideas and voting to collectively identify the grand challenges that need to be addressed most. A major part of the report is devoted to looking beyond 2020 at how we can advance the delivery of high-quality eye care for all. Building on the World Health Organization World Report on Vision, the Commission urges countries to consider eye health to be an essential part of universal health coverage. Indeed, we argue that UHC is not universal without affordable, high-quality, equitable eye care. It needs to be included in national health policy, financing mechanisms, workforce planning, and healthcare delivery. The Commission also explores how health systems can operationalize integrated people-centered eye care, a core concept in the World Report on Vision. Integration of eye health services within multiple relevant components of health service delivery and at all levels of the health system is of central importance. Coordinated intersectoral action is needed within healthy aging initiatives, schools, and the workplace. The health workforce is key. There is a clear association between low numbers of eye health personnel and increased prevalence of vision impairment. In addition, the report explores issues of aligning the workforce to population needs, enabling environments, and strengthening training. Technology and treatment developments offer new tools to improve eye health, for example, mHealth and artificial intelligence. Thoughtful application is needed to maximize the potential impact. If you'd like to hear more about the Commission's analyses, including on health financing, quality, equity, and indicators, can I encourage you to join us for one of the 2 webinars that follow? The Commission has 10 key messages in the summary. However, our most important message can be found on the front cover. Investing in universal eye health is a realistic, cost-effective way of unlocking human potential by improving health and well-being, education, work, and the economy. It is essential to achieving the Sustainable Development Goals. The Commission seeks to reframe eye health as not only a health matter, but also an enabling cross-cutting issue within the SDG framework. We believe the evidence in favor of urgent global action on eye health is compelling. On behalf of my fellow commissioners, I commend this report for your attention. Thank you, Femi.
Professor Matthew Burton, this has to be said. You have an extraordinary voice. Is the Lancet Global Health Commission on Global Health ever decide to do a podcast? I feel that you narrating it will persuade the world that there needs to be eye health care for all. And you may have a 2nd or 3rd career there ahead of you. Thank you so much for that presentation. Really appreciate it. Brandon R. Tong. Hello, Brandon. Thank you for your patience. Brandon is the head of public policy and advocacy at the Fred Hollows Foundation, making the connection between eye healthcare and the SDGs. Go ahead, Brandon. Nice to see you.
Nice to see you. Thank you, Femi. Excellencies, friends, talofa lava, kia ora, and g'day from the lands of the Wurundjeri people here in Australia. In 2019, the WHO World Report on Vision took that important step of placing eye health squarely within universal health coverage, which is so central to SDG 3 on health and well-being. The Commission builds on this, expressing eye health as an intimately interwoven thread across the Sustainable Development Agenda. Through an exhaustive and systematic scoping review, the Commission provides a novel illustration of the current evidence for eye health and the SDGs within an academic framework. It demonstrates links with specific goals and provides a comprehensive narrative in drawing it all together. Now, Matthew has mentioned the links with health, well-being, and mortality. So I'll briefly touch on the evidence beyond SDG 3 in health. For the economic-related goals 1, 2, and 8 on poverty, hunger, and economic growth, iHealth was found to improve household per capita expenditure, household income, employment rates, and economic productivity. In India, among tea workers with near sight loss, a randomized control trial showed the provision of free spectacles improved workplace productivity by some 22%. In the Philippines, for people who had undergone cataract surgery, a study showed an 88% increase in household per capita expenditure over a year. For Goal 4 in education, iHealth services were found to improve academic test results. In China, providing glasses to children with refractive errors reduced the odds of failing a class by some 44%. In relation to equity, Goal 5 on gender and Goal 10 on inequality, targeted iHealth services were found to eliminate gender disadvantage. One study showed trained rural community iHealth volunteers in low and middle income settings reduced gender inequality and blindness rates, clinic attendance, and treatment coverage for both cataract and trachoma. And in relation to Goal 11 on sustainable cities, iHealth services were found to reduce motor vehicle crashes. So it's also important to note that while there were no studies that met our strict inclusion criteria for the remaining SDGs, we contend there are other direct and indirect links with iHealth and all SDGs. We know, for example, environmentally responsible iHealth services would reduce carbon emissions and plastic waste, contributing to goals on clean energy, consumption and climate action, and life below water and life on land. So drawing upon the evidence, the Commission recommends first and foremost that iHealth be reframed as a development issue. iHealth has profound implications for all aspects of life and is therefore essential to meet the ambition of the 2030 Agenda. However, today, iHealth does not currently feature within the targets and indicators of the SDG monitoring framework. Now, if we're to truly stride forward, we need political, policy, and financial recognition of iHealth, commensurate with its impact on individuals, on families, communities, and the world. The Commission urges us all to pick up this challenge, act on the evidence we have before us, resolve to fill gaps in our understanding, and be the change that we want to see for a peaceful, prosperous, and sustainable future for all. Thank you.
Thank you very much, Brandon. And now Dr. Patricia Marquez.
Excellencies, ladies and gentlemen, thank you very much for the opportunity to share with you today a little of the work that the Commission has done on the health economics of iHealth. As part of this work, we have systematically reviewed the published literature on the economic effects of vision impairment and iHealth. We present a new estimate of global productivity losses and an analysis of the cost effectiveness of treating cataract and refractive error, the two leading causes of vision impairment. We generated regional and global estimates of annual productivity losses using the most recent prevalence, demographic, and economic data. The VLADGE Global Burden of Disease study provides us data from the latest model that estimated that in 2020, there were 161 million people in the working age population who were blind or had moderate or severe vision impairment. Based on a literature review, we determined that the average relative reduction in employment of people with vision loss was 30% compared to people with normal vision. We estimated the global annual productivity losses attributable to vision impairment in 2018 to be $411 billion purchasing power parity. This represents 0.3% of the global gross domestic product and is comparable to the Republic of Ireland's GDP in the same year. Half of all global productivity losses were concentrated in 3 regions: East Asia, South Asia, and high-income North America. In East Asia and South Asia, this was primarily due to the large number of people with vision loss in the working age population, while in North America, this was driven by the higher GDP per capita and higher relative reduction in employment. Our calculation is relatively conservative and probably underestimates the full extent of productivity losses, as it does not include a number of additional elements, such as the productivity losses of caregivers or reduced productivity at work. We have also examined the cost-effectiveness of eye care health interventions. We focus on cataract surgical services and refractive error services, as these account for more than 90% of vision impairment globally. From our systematic review, we looked for studies reporting health benefits using disability-adjusted life years, DALYs, or quality-adjusted life years, QALYs. Most cost-effectiveness were less than 1,000 per DALY inverted or QALY gain. Moreover, in many low and middle income settings, the cost-effectiveness ratios were below 100. This indicates that cataract surgery and refractive error services are cost-effective in many settings. This should encourage countries to prioritize eye care delivery services. We believe that there is clear evidence that unaddressed vision impairment results in substantial economic consequences. Set against that is the clear cost-effectiveness of the interventions to address cataract and refractive error, the leading causes of vision impairment and blindness worldwide. Decision-making on eye care financing and provisions of services will benefit from improved economic evaluation studies. Thank you.
You, Dr. Patricia Marquez, and thank you, audience of more than 400 people around the world currently watching Vision for Everyone, Unlocking Human Potential. So as this is a virtual event, over 400 viewers, thank you for watching, I can take you anywhere in the world. So let's go to Uganda.
My name is Simon Arunga. I work as an ophthalmologist here in Uganda. The Commission report presents compelling evidence of the growing magnitude of poor eye health and the pervasive inequality in accessing good eye health care across the world, especially in low and middle-income countries, among women, rural communities, and minority groups. If business remains as usual, the projected impact of poor eye health on the general health and economic outlook is indeed very worrying. Therefore, action to prioritize eye health is needed now. This report calls on the global community to consider the recommendations outlined in the key messages panel for urgent action. The Commission report has presented evidence of vision as an enabling tool for sustainable development, accelerating the delivery of the SDGs by contributing towards poverty reduction, zero hunger, good health and well-being, quality education, gender equality, and decent work. Therefore, eye health needs to be reframed as an enabling, cross-cutting issue within the Sustainable Development Framework. The decade of action called for by the 2019 UN General Assembly presents an opportunity to reintegrate eye health into developmental and economic plans. Eye health is an essential component of universal health coverage. Universal health coverage is not universal without affordable, high quality, equitable eye care. In line with the WHO World Report on Vision, we urge countries to include eye care as an essential service within universal health coverage. It must be included in the national strategic health plans and development policies, health financing structures, and health workforce planning. Financial barriers to accessing eye care leave many people behind. Many people, especially in low and middle income countries, cannot afford out-of-pocket costs for a simple cataract surgery or a pair of glasses. This financial hardship is against the tenets of UHC. Therefore, eye health needs to be included in the national health financing to pull the risk and remove cost barriers. More investment in interventions which have proven to work should be strengthened. For example, treatment for cataract and refractive error would meet more than 90% of the unmet needs. And these are highly cost-effective. Governments need to commit more resources to this. Finally, through multi-sectoral collaborations, the UN, international agencies, governments, and eye health leaders across the world have an opportunity to shape the global eye health agenda and give it the prioritization it urgently needs to unlock human potential.
Dr. Simon Aruga firing us up from Uganda there. So you have heard over almost the last 90 minutes the case for eye health care really feeding into the Sustainable Development Goals, that connection, how important that connection is. I want to get some responses, a couple of responses from important colleagues at the United Nations. So we start with Stuart Simonson, Assistant Director General of the WHO at the United Nations. Stuart, thoughts?
Cheers. Thank you, Femi. Chairs, Excellencies, colleagues, ladies and gentlemen. The World Health Organization is grateful to be included in today's event and welcomes the results of the Lancet Commission on Global Health, Eye Health. They amplify and provide additional evidence in support of the key recommendations of WHO's World Report on Vision that was launched in 2019. The statistics and results from the Commission provide a sobering reminder of how much work needs to be done in the field and how seriously eye health should be taken. The fundamental priority over the coming decade must be the implementation of integrated, people-centered eye care. And the focus must be on strengthening the delivery of eye care within universal health coverage so that all people can obtain eye care services they need without the risk of financial hardship. And I can tell you firsthand from my work years ago at a hospital in rural northern Haiti, where there is a risk of financial hardship related to eye care services, there is preventable blindness and unnecessary suffering, and it need not be so. It was very encouraging to see the commitment of member states to this agenda and the adoption of the World Health Assembly resolution on integrated people-centered eye care in 2020. Importantly, beyond Sustainable Development Goal 3, the Commission emphasizes the strong link between eye health and the achievement of many other goals, such as those related to employment, gender empowerment, education, transport, and inequalities. WHO is pleased to see movement on a United Nations General Assembly resolution related to vision health, as it will elevate political interest and encourage greater coordination on vision with other global development priorities. At the core of this link between eye health and the broader SDGs is the need to provide equitable access to eye care services within the health sector. Health is, after all, a precondition, an indicator, an outcome of sustainable development. If eye diseases are diagnosed and treated through timely access to quality and affordable eye care services, then the positive contribution of eye health will cascade throughout the full spectrum of Agenda 2030. As outlined in the WHO World Report on Vision and underscored by the findings of the Commission, there are a number of actions that must be taken. need to be taken and must be taken, like inclusion of eye care in national health strategic plans and benefit packages, health workforce planning, and strengthening eye care within primary health care. Thank you again for including the World Health Organization in today's important event. We appreciate it.
Thank you very much, Stuart. We go now to Beate Andres, Special Representative to the UN and Director of the ILO Office for the United Nations. Welcome.
Thank you so much, Femi, and thank you also Ambassador Webson, Ambassador Babab Fatima, Ambassador Byrne, and colleagues from the UN, the International Agency for the Prevention of Blindness, and from the research community. Thank you really for including the ILO in this very rich discussion and for sharing this excellent data with us. We've looked very carefully at the data pertaining to productivity and employment, and I think it makes a very compelling case to focus on global eye health and the workplace. So I just want to make three quick remarks. First, starting with prevention. I would like to stress the duty of care of states and of employers and businesses. And that's based on international human rights law as well as international labor law. I will not go into the details here, but it's very clear that the international legal framework is there. So states have the duty of care to provide social protection floors. This includes universal health care. It should be non-discriminatory, share risks, and promote solidarity. Now, of course, as we've heard in many of the examples that were shared, many countries, in particular developing countries, need the fiscal space to design such policies. And the ILO is very pleased to be working with other UN agencies such as UNICEF and the WHO to advocate for macroeconomic policies that are conducive to creating fiscal space for better health care. The second point pertains to the duty of care that employers and businesses have to protect their workers from occupational injuries and diseases. In the workplace, eyes can be exposed to flying particles, to corrosive liquids, to bad lighting. All of this impacts on eye health. And employers must provide personal protective equipment when this is needed. And of course, the ILO, by working very closely with OSH inspectors, promotes this very concretely in the workplace around the world. And then finally, let me just make a plea here for inclusion. People who are blind or visually impaired have the right to be included in the workplace. The ILO Global Business and Disability Network, for example, is a place where employers can share good practices to improve accessibility, to help with the adjustments in the workplace, and develop skills in the digital economy. So to conclude, ladies and gentlemen, we see prevention and inclusion really as two sides of the same medal. There is no reason that people with vision impairment or at risk of vision loss should be left untreated or excluded from the workplace in the 21st century. Thank you very much. Femi, over to you.
Thank you so much. And thank you, audience from Nigeria, the UK, Saudi Arabia, Canada, all over the world. A lot of you have been saying, where can I get more information? So we will get that to you. There will be links. There are links on the page for the IAPB. A lot of you have been saying, wow, we learned so much about eye healthcare and gender and equality. That was the whole point. So mission accomplished and still so more to do. This has been a co-production of the IAPB and the UN Friends of Vision, and of course with you. Thank you for being part of Vision for Everyone, unlocking human potential. Let's see what we can do now and going onwards the next 10 years. Thank you for being part of today's event.